Lunch and Learn. Thank you, Creighton, for starting the recording. Welcome to our Lunch and Learn from Able New Hampshire's Transportation Equity Task Force. Today, we're here to learn together. Just a little bit of housekeeping. Everybody's cameras are turned off, and the chat feature is available for you if you want to chat when we get to question and answer portion. Everybody's sound is muted as well. Just raise your hand and chat with us if you want to be recognized. This is going to feel a little bit more like a webinar than an interactive session, just for the sake of keeping things focused on our presenter for right now. Advocates Building Lasting Equality in New Hampshire advocates for the civil and human rights of children and adults with disabilities. We promote full participation by improving systems, connecting families, and inspiring communities, and influencing public policy. That is the mission of Able New Hampshire, which is presenting this Lunch and Learn today. Able New Hampshire chooses task forces that support people with intellectual and developmental disabilities. And every year we have an annual meeting at which we select which task forces should be prevalent for us. And 2 years ago in 2023, we decided that one of the task forces beginning in 24 was going to be the Transportation Equity Task Force. It was selected and we began running. And for this year, one of our primary initiatives is this Lunch and Learn series. If you want to learn more about the task force, you can scan the QR code and get to the webpage for the Transportation Equity Task Force to learn what we're up to. As I mentioned, the Lunch and Learn series is one of our biggest initiatives for right now, and we do have several sessions that are coming up. In July, it's getting to appointments with Medicaid, and then we're going to talk about the Volunteer Driver Initiative, Keep New Hampshire Moving, Welcoming Transportation in October, and in November, we're going to talk about what's new with Uber, because we believe that there are some new and exciting things that should be available coming up this fall. The last two presentations that we have done have been on ADA rights for transportation, and also we've talked about our mobility manager network. We create one-pagers for each one of the presentations that we do, and you'll find our one-pagers on the transportation page on the Able New Hampshire website. And today we're going to be talking about Medicaid waiver everyday transportation with Lindsey Magee. So at this time, I'm going to turn it over to Lindsey Magee, and she is going to talk with us about today's topic. Thanks, Lindsey.
Thanks, Lisa. I am going to share my screen. Okay, share. All right, can you see my PowerPoint presentation? Yes, Lisa.
Yes, I can.
Okay, perfect. Yeah. Perfect, thank you. So my name is Lindsey Magee. I am the waiver manager with the Bureau of Developmental Services. I'm so excited to be here for this Lunch and Learn today. I hope you guys are enjoying something exciting for lunch. I had mine before, so I don't have to talk and eat at the same time. So today we're here to talk about non-medical transportation. So that is a waivered service on the DD, ABD, and IHS waivers. It is also a service on the CFI waiver, but that's not my area of expertise. So I'm just going to be talking about our three Bureau of Developmental Services waivers today. If you've been to one of my sessions before about services, this will probably look very familiar, kind of talking about what does the service mean? How do I access it? Are there any limits or restrictions? So that's what we're going to go through right now. Perfect. Okay, so this first slide is the definition of non-medical transportation within our waivers, and then kind of some more information on, but what does this actually mean? So non-medical transportation in the waivers is described as transportation services that are designed specifically to improve the individual and the caregiver's ability to access community activities within their own community in response to needs identified through the service agreement. So what does this really mean? Really, non-medical transportation is there to help individuals and caregivers do things like travel from one place to another, It could be prepaid transportation vouchers and cards. It could be public transportation, taxi services, mileage reimbursement. Travel training also is something that can be covered under non-medical transportation. And then rideshare services, things like Uber and Lyft, those are also allowable to be used in non-medical transportation. And I will just plug really quick, I'll talk about it in a little bit, but our waivers are starting to go through the 5-year renewal process. So the in-home supports waiver is being renewed right now. And we have added language to allow for really to ensure that Uber and Lyft, it's clear in the waiver that those are allowable transportation agencies. And so you'll see that language coming up in the DD and ABD waiver as well. But I'll talk about that more in a minute. So here's a fictional scenario. It is not based on anyone real, really just trying to illustrate what does non-medical transportation look like, or what could it look like for someone who is accessing this service. So here's some background. We're going to call her Emily. Emily is a 22-year-old woman with a developmental disability who lives in an apartment. She enjoys participating in various community activities like going to the library and volunteering at the animal shelter. She does not currently have a driver's license, so she does not have transportation to access her community during the day. So how does Emily access and use non-medical transportation? She learns about the service. This could be from a conversation like this, her service coordinator, another individual who accesses the service, and she works with her service coordinator to have an amendment for her service agreement to add non-medical transportation. So her service agreement and the amendment outlines the schedule, the preferred routes if she has any, and any necessary supports that she may or may not need during her transportation. For Emily, she has chosen to use Uber vouchers to get to her community activities. So she works with her service coordinator to get vouchers for Uber so she can go to the library, she can go to the animal shelter, and that's where she goes. So what's the outcome of the service for Emily? So after accessing this service, she gains a sense of independence because she now has transportation to attend her favorite activities. This boosts her confidence and social skills, and having that reliable transportation allows her to participate in more activities. She can do more volunteering, she can visit the library more often, and this just overall contributes to her well-being. Okay, now we can talk about some service limits and requirements for non-medical transportation. Also, if it's available remotely or in acute care. So what does that actually mean? Remote services are when a service can be offered remotely. So it means you don't have to be physically present at a specific location to use it. Non-medical transportation, as we have down here, is not available remotely because you can't take a car ride remotely and you need to be physically present to have that ride. Acute care means that when services can be accessed in acute care, individuals who are in a hospital or another urgent care type facility can still receive that service. Same thing if you're in an urgent care setting or you're in a hospital, likely not going to need non-medical transportation. So it's not available in acute care. The last one is service limits. And this is something that you may hear frequently talked about is, well, let me go back, hold on, is services that may have specific limits. So that could mean a restriction or a cap on the type or the cost or the amount of a specific service. Most of our services, including non-medical transportation, have soft limits. So as we show here, there is a limit of $5,000 per year, or for individuals on the DD and ABD waiver, There's a $10,000 limit if they require specialized transportation. So that would be something like a wheelchair van. There is an increased cap for that. However, those are soft limits. So what that means is you can ask to exceed. And if BDS gives permission, which is very frequent, I believe, you can access non-medical transportation above that cap. We also have a requirement for the service agreement. So really the service agreement just needs to describe that the individual is using non-medical transportation. They need it to access their community. It does not need to be a long description of the service. Okay, so I wanted to show this screen too, and I can put it in the chat after I stop screen sharing. Over the summer, we did some kind of webinar style presentations on all services in all three waivers. So we do have a presentation that's on our website, our individual and family resources page, specific to non-medical transportation. So there's a PowerPoint presentation, and then there's just a recorded webinar style presentation as well, that you can listen to or look back at if you need. So before I get to questions, I do have a couple other things that I don't have on slides. I do want to plug our regional liaisons. They are such a huge resource for really just working with the team, creative thinking. You know, maybe you've tried to access non-medical transportation, but it's not working exactly how you'd like, or maybe there's, restrictions that we're not quite sure if that's accurate. Always reach out to the liaison. They're happy to join team meetings. I'm happy to join team meetings. It's never a bad thing to call them. It's really just to be part of the team and to kind of hear what's going on and help brainstorm and see if we can make the service work for how you need it to. Lisa plugged Uber Health for something that we're going to talk about later this year, but super exciting things happening with Uber Health. We've met with them a couple times. They do provide non-medical transportation in some other states, and they are working on, they've called it a member self-booking option. Right now, individuals aren't really able to book rides themselves and have it be covered through this, but they're working on that. And that's what's coming. They said 2025. So I'm hopeful that before the end of 2025, this will be available for individuals to use. But this self-booking option, this app, I think it's part of the regular Uber app, but now it's recorded. Don't quote me on that. So this will allow people to, maybe they have a cost limit, maybe their service, non-medical transportation is approved for $4,000. So this app will know this individual only has $4,000 to spend on non-medical transportation. Maybe an individual has restrictions on they can't go to a certain location for whatever reason. Of course, if that's outlined in a behavior plan and there's a reason why there's a restriction in place, this app will know that and know that if someone tries to book a ride to a place that they can't go to, it won't work. The last thing I wanted to talk about too was so I mentioned before, the waivers are going through the renewal process. We've definitely gotten a lot of feedback of things that may not be working well. Maybe they are working well, but I wanted to plug the DD and ABD informal public comment sessions. We're going to start that process in September. So that's really before we start drafting the renewals of these waivers, your opportunity to say, this is not working. Can we change this? Give us any and all feedback and suggestions and ideas that you have. that's the perfect time to do that. Same with in-home supports. Our public comment officially closed yesterday, but that does not mean we are shut down for hearing comment. I definitely, if you have anything that could be helpful for in-home supports, non-medical transportation or otherwise related, we're happy to hear it and take it in. So I think we're ready for questions.
Lindsey, I'll kick it off with the first question. It's something that you and I discussed the other day. What if it's a parent who doesn't have a driver's license or they don't have a vehicle and they need to take their kiddo to daycare or to a non-medical appointment like therapy?
Yep, I think that's a great question. And I think it goes back to the service agreement. And is there an assessed need for that kiddo to access that service? Also looking at if there are any other community resources that may be able to help. But if not, then I do think that non-medical transportation would be an option for this individual. And it gets tricky too, because it is so individualized. So one person may have an assessed need and need to access this service, but it might not be the same for another person. So that is really where we want to have those individualized conversations.
So at this time, we'll invite people to type some questions into the chat. Go ahead and raise your hands, and I'm going to remove the spotlight from Lindsey. And Lindsey, if you stop sharing screen, then we'll be able to get a view of hands that pop up here. If anyone's having trouble raising their hand, just let me know. Availability of resources in rural areas where there is no public transportation, taxi, or Uber or Lyft. Then how would you utilize this service option?
That's a great question. And that is something where we are working with provider agencies as well that may be able to also offer this service. So it doesn't have to be a transportation company. It could be, Lindsey's provider agency, who also, as part of my service array that I provide, is non-medical transportation.
We have someone asking, I heard you mention a webinar and some other resources for this information. Will there be information available for later viewing?
Yes, I said I was going to put that in the chat, and I will do that right now.
All right. I am going to unmute Obast. Can you share your name and ask your question, please?
Yes, it's Owen actually. So I just, for whatever reason, when I'm not logged in, it doesn't actually show my name. But I'm an able member, and I was wondering if because we're organizing some rides and making sure people have rides lined up, and I'm just curious because we've got people who would need rides, but who also qualify for the waiver. And so I was wondering how one would go about in terms of like helping people set that up in terms of like as an organizer, and especially going from one catchment region to another catchment region.
That's a great question. I would encourage individuals who would like to access this service, if they're currently on the waiver, to speak with their service coordinator. If they already are on the waiver and they have a service agreement, their service coordinator can put up an amendment and a service authorization and get that request put in.
All right. Laura has typed a question, and also she's raising her hand. So I'm going to unmute you. And Laura, if there's something that you want to share that is not typed, then we can read that for you as well.
Yeah, so I got a neurosurgeon. I have hydrocephalus, and I haven't been diagnosed with a developmental disability. So the waiver, I'm kind of like, I don't know I qualify for that. And I'm kind of like, is there something for me specifically? I'm on my own, I'm in housing, but I spent like well over $100 that day. and 2 trips to Boston to get back to New Hampshire, if that makes sense, which it doesn't, but that's exactly what I did to get to Lebanon, New Hampshire, right? I don't drive, and I never have. And I made a ton of calls to people trying to get a ride. I really did. I tried everything. I tried caregivers. I didn't not try anything. And I'm wondering if you have an idea for me for next time. This doctor is on board. I had a very hard time getting a doctor to see me with my case, and I found one, and now I'm working on this. Is there anything you could offer me that I haven't tried?
And are you looking for transportation to the medical appointments or just transportation in general?
Yeah, non-emergency medical for me. And I was told like I don't qualify, or I was told, $22 an hour plus mileage, which is about what I paid, but it would be direct route. That would be the perk of doing it that way next time. But just wondering, caregivers, I guess, couldn't help me.
Laura, I think you'd be very interested in listening to our next Lunch and Learn, which is on non-emergency medical transportation. Anybody who has New Hampshire Healthy Families or WellSense or help me, it's AmeriQuest. Lindsay, what's the third one?
Oh, I'm on, that's another thing. I'm on Medicare. I'm on Medicare and I'm on Quimby. So my Medicaid number, I'm not on Medicaid, but my Medicaid number is my Quimby number. That's a facet that I needed to tell you about, is I'm on Medicare, not on Medicaid.
I really appreciate you asking this question because it helps us to highlight the difference between this service option and the non-emergency medical transportation. Non-emergency medical transportation is paid by the health insurance companies, and this service option is paid by the Medicaid waivers. So it's a separate thing.
Separate.
However, folks who are traveling for medical appointments can learn a little bit more next month, and those should be reimbursed by the health insurance companies that you're working with.
I did call them. I'm on Medicare. Sorry, the wind. I'm on Medicare Advantage.
Okay. We would be happy to chat with you offline about and brainstorm some ideas about how we might be able to help you out. I see another question in chat. Let's see. Ann's first question, great example, is where collaboration with the regional coordinating councils and regional mobility managers can help us improve statewide community transportation network. Let your RCC and RMM know of these gaps. It's AmeriHealth. Thank you. New Hampshire Healthy Families, WellSense, and AmeriHealth Caritas are the 3 health insurance providers for New Hampshire Medicaid, and those are the ones we're going to be talking about next month. Creighton is the man behind the curtains here. And Creighton, have you seen any other questions that we missed in the chat?
I haven't.
Thank you very much. Is there anyone else who would like to ask a question right now? And do you have a question about a specific acronym that you've heard? We'd be happy to define it for you.
I don't want to jump in, but I did catch myself when I said DD, ABD, and IHS. So I can explain what those are. The DD waiver is the developmental disability waiver. So that's through BDS. ABD is the acquired brain disorder waiver, and IHS is the in-home support waiver.
IHS is traditionally children, right?
Yes, correct.
And DD waiver is generally adults, and acquired brain disorder is generally for people who have acquired brain disorders, traumatic brain injury. Yeah.
And I just saw the question too about transportation to and from work. So the answer is yes. That can kind of depend too on if the individual is receiving another service, maybe like supported employment, and part of that service may be transportation. If transportation is not part of that service, then yes, they absolutely can access non-medical transportation to get to and from work.
All right, I'm going to share a feedback form in the chat. People are going to have additional questions, I'm sure. And on this feedback form, you can share your email address with us. That's the most important thing because it gives you an opportunity to let us know that you're going to want to hear about future presentations from the Transportation Task Force. So that link is there and you can start filling it out. We're going to continue some question and answer a little bit more after I complete just a few more slides and wrap up this part of the presentation. Then we'll hang around with Lindsey a bit more. Is everyone seeing non-emergency medical transportation flyer up on screen? Lindsey, is that what you see?
Yes.
Okay. This is a flyer for our next presentation. I just mentioned that we're going to be talking about the service option. Well, not service option. The reimbursement for rides and also provision of rides through the medical insurance companies. We'll have that with Michelle Cutting, and that will be on July 18th of next month. The closing survey can be scanned by the QR code, or you can go ahead and answer that by the link that I dropped into the chat box for you. Again, it's very important that you at least answer with your email address. That way we know you were here and we can keep you in the loop for future presentations of this task force. Otherwise, we will not be able to know that you were here because we didn't have anyone pre-register. We wanted to keep it open for everybody to just drop in if they wanted to at their leisure. Able New Hampshire is supported by members and by donations and grants. We have Creighton, one of our employees here. We wouldn't be able to pay Creighton and to do the great work that we do without our members. If you're interested in becoming a member of Able New Hampshire, we would very much appreciate that. We do lots of really incredible things here. And also, thank you for coming to the presentation. At this time, we're going to go ahead and turn off the recording and hang out right up until the end of the